Hello and welcome to our LCAP community conversation for this month. I'm Brian Landisi, Director of Student Intervention and Accountability, and I'm very pleased to welcome Dr. Narine Kamichian, who's our Interim Director of Student Wellness Services. We hold these conversations so that we can talk with our community about the LCAP and to review our student wellness and connectedness data. We also want to share with you our comprehensive school mental health program, discuss interventions within our multi-tiered systems of support, and also get your feedback. A little background, the LCAP, the Local Control Accountability Plan, is a 3-year plan that we develop with our educational partners across the district. And this includes our goals, actions, and expenditures to address the state and local priorities that we've set here in the district. The LCAP and school funding, it's important to know that California schools are funded through the local control funding formula. And each year we develop our LCAP to decide how to use those funds to meet the needs of all our students. The LCAP is totally aligned to our GUSD Board of Education priorities. And at this time, I'm happy to share that we're going to discuss mental health, but I also want you to take a look at the calendar of the upcoming events that we'll be hosting here on our webinars, and also we'll be making them available as videos for our community to watch later on. Let me turn this presentation over to Dr. Kamichian, who will walk you through today's overview and get into the presentation.
Good afternoon, everyone. Thank you so much for having me, Dr. Landisi. It's a pleasure to be able to speak a little bit about our mental health programs and initiatives and provide you some updates. So initially, I will be sharing some counseling data with you. I will then talk a little bit about our mental health staff, the evolving mental health program model in response to the funding changes that we experienced last year, the supporting students affected by immigration-related challenges, and then we will talk a little bit about Children and Youth Behavioral Health Initiative, CYBHI, which is a new program. So as you can see, in the 24-25 school year, we were able to provide counseling services to 1,573 students. Of those students, 969 of them were brand new referrals that were sent to our department, the Student Wellness Services Department. 508 of those referrals were special education referrals, so these were for students who had an IEP. And 96 referrals were for telehealth. And majority of these students received these services from the comfort of their home. And I have to say that we are very grateful for our partners at Hazel Health who provide telehealth services for us. And on this slide, we have some information about the current counseling caseload for this school year. So in the past couple of months, we've received 183 brand new referrals to the Student Wellness Services Department, 392 referrals for the Special Education Department. And again, these are students who receive counseling services through their IEPs, and 19 referrals for telehealth services. So a total of 594 counseling services that we're currently providing. And this is a quick snapshot of the Panorama survey results. We are looking at 3 different categories: emotional regulation, social awareness, and sense of belonging, which is highly correlated with mental health and well-being. In terms of emotional regulation, we're looking at 2 different cohorts, grades 4th through 5th as our elementary school sample, grades 6th through 12th as our secondary school sample. And as you could see, the survey was administered in the spring of 2025 and spring of 2024 with not too much variability within these numbers. And it's important to also compare these results with our national averages. And when we do that, we see that we're slightly above the national average, but not as much. So kind of where we would expect to be given the student's developmental stage. With the exception of sense of belonging in the secondary student population, where we're slightly below. Next slide, please. We continue to be able to offer multi-tier systems of supports for our mental health services and programs. At the Tier 1 level, we offer universal supports to all of our students through mental health instruction, district protocols, and awareness campaigns. At the Tier 2 level, we offer supports and services to groups of students who are categorized as at risk for support. And these are targeted group interventions. And at the Tier 3 level, these are for identified students and they receive intensive individual interventions. And these are primarily our one-on-one services. Next slide, please. A little bit about our counseling staff, and this is the Student Wellness Services Department. We do have counseling providers in the special education department as well, but primarily we have 10 psychological services providers, and these are either associate marriage and family therapists, licensed marriage and family therapists, or associate clinical social workers or licensed clinical social workers. We have 3 associate level psychological services providers and 7 licensed psychological services providers. And of the 10, 2 of them are clinical supervisors. So they supervise our associate level therapists as well as our 11 interns. And the interns are from CSUN, Cal State LA, USC, and Pepperdine. I do also have to mention that we have 2 wonderful homeless and foster youth counselors who meet the needs of our unhoused students as well as our foster youth. Next slide, please. The mental health delivery model. So for this school year, we continue to offer individual counseling at the school sites. For our elementary schools, primarily those referrals are vetted and assigned to interns if it's an appropriate assignment. We also have PSPs assigned to our secondary school sites, and they provide counseling services to our 6th through 12th grade students. 504 counseling services are provided through our psychological services providers. Group counseling is also available by our psychological services providers as well as interns, and they collaborate on these groups. Related services counseling, and this is counseling services again for special education students who have that service written on their IEPs, and those are provided by our school psychologists and our related services counselors in the special education department. School-wide crisis intervention, we are available and support our schools at any given time if there is a school-wide crisis. Our PSPs, our psychological services providers, and school psychologists are dispatched to those schools, and we provide necessary supports. Suicide risk and threat assessments, also this is a multidisciplinary team that conducts these assessments, and our psychological services providers as well as our school psychologists lead these assessments. Next slide, please. This is a chart sharing information and data on our suicide risk and threat assessments. So as a review, we provide suicide risk assessments for students who share thoughts of hurting themselves, and we conduct threat assessments for students who share thoughts of hurting others. And as you could see in the year 2024-2025, so in the last school year, we did 448 of these assessments, of which 45 were hospitalized. And in the previous year, the numbers are pretty similar. 450 assessments were completed, and 37 students were hospitalized for further care, a higher level of care. I'm so sorry, Dr. Landisi, thank you. And as you could see in the year 22-23, we had about 100 less assessments that we conducted. And that we primarily think is because of the Senate Bill 906 that was passed that mandates that we conduct threat assessments for students who share thoughts of hurting others and inform law enforcement of these incidents for grades 6th through 12th. And so that, of course, increased the number of assessments that we were conducting. Next slide, please. So this chart depicts the number of special education students versus general education students that have these assessments conducted in the last school year. And as you could see, about 37% of our assessments were conducted on students who are in the special education program. And this primarily is because one of the eligibility criteria for special education is emotional disability, which is for students who qualify due to high levels of depression and anxiety. And so, of course, there are incidents where they have these needs for the suicide risk assessments or threat assessments. And that's why the percentage is at 37%. And we are at around 9% for hospitalizations. And these are students who require a higher level of care. Next slide, please. In order to be able to offer mental health supports to all of our families, we have been able to partner up with a lot of different mental health agencies in our community. D.D. Hirsch and Pacific Clinics are partners that we have worked with for many years. Counseling for Kids, Anchor Counseling Group, the Korean American Family Services, International Institute of Los Angeles, All for One Therapy, and Community for Armenian Students in Public Schools are some groups that we work with. And for example, CASPS, the Committee for Armenian Students in Public Schools, offers us some group art therapy at some of our schools. Next slide, please. I wanted to highlight the substance use intervention program that we have and the initiatives in our schools. This is an area that we focus on and we take very seriously. We partner with Tarzana Treatment Center and the Glendale Police Department to provide education to our staff, to our parents, and our students. We have a substance use disorder counselor at 3 of our high schools. And they also provide parent and staff training at these schools as well. For our Glendale Police Department, they have a substance abuse and wellness resource program, and we partnered with them to bring to our district the youth empowerment program. And we offer this twice a year, and it's offered for 8 sessions each time. And this is a program for students and parents, and they attend together. And we primarily discuss topics that are, for teen related, talking about communication, substance use, digital wellness, importance of sleep, and other health related topics. The Glendale Police Department also provides a lot of training for our staff, parents, and students regarding substance use as well. Next slide, please. Bridge to Belonging is a curriculum that we developed in-house for our newcomer students. And this program and this curriculum addresses stress related to immigration and acculturation. So for our students who are new to the country, we offer 8 one-hour group sessions at our schools. And last year, this program was requested and offered at Horace Mann Elementary School, Glen Oaks Elementary School, Keppel, Cerritos, John Muir, John Marshall, Roosevelt Middle School, and Hoover High School. This program also has a parent component, and through that process, we address parenting while experiencing immigration and acculturation stress. We offer 3 parent support groups, and we also link our families with community resources through this program. Next slide, please. The Children and Youth Behavioral Health Initiative. So this is a brand new initiative, and this is actually a game changer for us in terms of access to school-based mental health services and funding. So under the CYBHI initiative, California's health plans, and these are insurance companies, including Medi-Cal, are now required to reimburse public schools for mental health services provided to students. So there is absolutely no out-of-pocket expenses for our families, no co-payments, no deductibles. We, of course, get the permission from our parents to be able to bill our insurance companies. A claim must be submitted on our behalf. Again, it does not impact the family's insurance in any way. This is a separate pot of money set aside by insurance companies for public schools. If parents do not feel comfortable and they do not authorize for us to bill for these services, then we don't move forward with the billing process, but we do continue to offer services to our students. Next slide, please. And finally, families impacted by immigration-related challenges. So this year, we do have students who are impacted by immigration-related challenges. And as you can imagine, this takes a toll on their emotional well-being. It takes a toll on their ability to focus in school, attend school regularly, and have access to resources. And so as soon as these families are identified, and primarily the identification process is through self-identification, they approach either the teacher or the principal or come to our department directly, and we do an informal assessment to see what their needs are. So for these families, their needs are quite different. And as soon as we know what their resources are and what barriers they have to education, we offer them mental health services, we offer them academic tutoring, referrals to medical care. We offer them access to our GUSD pantry, which has available for them food, clothing, school uniforms, shoes, hygiene kits. If they have difficulty with transportation, we help them obtain bus passes and referrals for shelter as needed. We hope that by providing them with these resources, we're able to alleviate some of the stressors and allow our students to progress academically and socially and emotionally.
I want to thank Dr. Kamichian for sharing all of this very valuable information. We want our community to be informed, but we also value your feedback. If you have questions or thoughts, we've provided a prompt at the gusd.net/share link, and we invite you to complete our quick survey now that you've had an opportunity to hear this information. And we use this data from our community members and educational partners to help shape our LCAP for the coming year. We hope that you'll join us next month for our community conversation on student achievement, and you can always learn more about our local control accountability plan on our website at gusd.net/LCAP. Thank you again for joining us. We appreciate our guest speaker today. Thank you again.
Thank you.